Hi, everyone. Good morning. We are so thrilled to have you joining us this morning. It is now 10 o'clock and we are scheduled to start pretty soon, but we'll allow at least another minute for additional folks to start trickling in. But thank you again so much for being here, and we will get started shortly. Good morning, everyone. As some of you may have heard, we will be starting in about I want to say 30 seconds officially. We're just waiting for a few more folks to trickle in, and then we'll officially get started. But thank you so much for being here. Okay, we will go ahead and get started now. I think that was enough time for us to just wait on a few folks as they were entering. But thank you so much again for being here with us today. And I do want to genuinely welcome everyone to this space for the next hour. We will be giving folks just a little bit more time to join us, but as they're starting to trickle in, I do want to say hello and thank you for joining us today for our feature webinar presentation as part of the Center for Native American Cancer Health Equity quarterly webinar series. It's pretty new, so this is our second segment, and we're so happy to have you here. I want to quickly introduce myself. I will be your webinar moderator for today, and my name is Carmen Lita Chief. I am a senior research coordinator with C-NACHE for short, but again, that is the Center for Native American Cancer Health Equity. I am a citizen of the Navajo Nation, and very quickly, I'll just share my plans to establish kinship relationships. But I am of the Red House people clan, born for the Reed people. My maternal grandfathers are of the One Who Walks Around clan, and my paternal grandfathers are of the Giant People branch of the Red Running Into the Water people. And I will be assisted today with my colleague, Jennifer Hudson, and I'll go ahead and welcome her onto the screen and introduce herself.
Hi, everyone. Good morning. My name is Jennifer Hudson, and within C-NACHE, I am the Senior Community Program Coordinator. And like Karma, I am also a citizen of the Navajo Nation. My clans are, I am Mountain Cove clan, born for the Blackstreet Wooded people. My maternal grandfathers are of the Towering House clan, and my paternal grandfathers are of the Water's Edge clan. And I'm really excited to have you all here today and for us to learn from Judith. Thank you, Carm.
Yeah, thank you very much, Jennifer. So the focus of today's webinar presentation will be tailoring cancer education, lessons learned from the Zuni Health Initiative. And we're so delighted to be joined by our featured speaker today, who is Ms. Judith Sheche. We will allow some time for her to more fully introduce herself when she actually gets to her presentation. But as for now, she is a senior research scientist at the University of New Mexico's Comprehensive Cancer Center. And just a general courtesy FYI to you all, this event will be recorded and the recording will be made available on our C-NACHE website. And I do want to acknowledge that this webinar series is supported with grant funding from the American Cancer Society. So before we begin, if you joined us in our very first webinar, you will remember that we had this slide up just to set our intentions for being here today. And before we begin, we would like to acknowledge the understanding that for many Native American and Indigenous communities, The subject of cancer is a culturally prohibitive topic of discussion, and many of us here in the room know that there are various reasons for this and that they do vary by communities within the region and throughout the world. Our intention here with C-NACHE, the webinar series, is really to approach these topics with utmost respect and care, and this does require recognition of spirituality that we know is integral to Native American traditional health models. And for this reason, we do want to allow you some time, I want to say at least 45 seconds, to communicate your intentions in accordance with your cultural ways and your practices. What is your reason for engaging in this discussion today? And it could also serve as seeking protection from possible harms that could arise. And we do know that this is often done through prayer, but you are welcome to communicate your intentions in a way that you see is a better fit for you. So I'll go ahead and start a timer and just give you about 45 seconds to just in your own way state your intentions for being here and seeking protection around some of the topics that we'll be discussing today. Okay, as you're starting to wrap up, I do want to thank you for your engagement in that practice of intentionality. And as we begin to move forward, we do also want to recognize the importance of land and connection to land for Native American health. And what you see here on this slide is really a visual image of where we are located as the C-NACHE Center here on the campus of Northern Arizona in Flagstaff. And in the background, you'll see a beautiful mountain known by its colonial name of the San Francisco Peaks. This mountain is held sacred by 13 Native nations in the region. And very briefly, I do want to share NAU's land acknowledgement statement at this time. So Northern Arizona sits at the base of the San Francisco Peaks on homeland sacred to Native Americans throughout the region, and we honor their past, present, and future generations who have lived here for millennia and will forever call this place home. And before we get into Judith's presentation, I do want to offer just a very quick primer on who are we at the Center for Native American Cancer Health Equity. Well, we're fairly new. We were established in December 2022. As I stated at the beginning, we have generous funding from the American Cancer Society, and that is from a direct award to Northern Arizona University. And our overall goal in all of the different capacities that we have within the center, our overall goal is really to reduce the unequal burden of cancer and advance cancer health equity for Native Americans, with a particular focus on those 3 bullets that you see there at the bottom. So we're really wanting our efforts to help improve cancer screening rates, to also increase access to cancer care services, and also increase just general knowledge and awareness about of how cancer-causing environmental contaminants can also be an additional burden to the cancer experience in our Native communities. So I believe this is my last slide here. So I really just want to share with you what is the intention of the C-NACHE quarterly webinar series. It really, if you saw the flyers and saw the promotions around it, our intended audience really are Native American students, college students, university students, And through the webinar series, we are committed to spotlighting the different types and aspects of cancer research that are occurring in Turtle Island, with a particular focus on the Four Corners region. And you know, this is research that is addressing the impact and prevalence of cancer within Native American communities. And as many of us might think, you know, the first time that we're hearing cancer research, oftentimes the image of lab coats or being in the lab, bench science is the idea or the image that comes to the forefront. But there's so many different ways that different disciplines can contribute to cancer research. And so we really want to show the interdisciplinary nature of cancer research and to really inspire and educate the next multidisciplinary generation of cancer researchers and advocates within Native American communities. So that is our intention with the webinar series. And again, we're so glad to have you here. And with that, I will gladly hand this over to our featured speaker, who again is Judith Sheche, and we'll allow her to introduce herself, and then we'll go ahead and get this started. But again, thank you so much for being here. Judith, I will transition over to you now.
Okay, thank you, Carmelita. All right, good morning. I am Judith Sheche. I am from Zuni, Keshe. Mallory, I see that you're on here. I am coming to you from Albuquerque, the traditional homelands of Sandia, but also other Pueblos, Navajo, and Apache. And I am here to tell you about my adventures in research, and especially this one study that I was able to do with my own community. So a brief outline of what I will cover today. So we'll start out with sort of my nonlinear journey in research and also dive into the cancer study. And I will also include a brief presentation about the summer research program that we have at the UNM Cancer Center. So for my beginnings, where I come from, I am from Zuni Pueblo, which is less than 20 miles from the Arizona state line. I was born and raised on the reservation. My maternal grandfather, I grew up on my maternal side, was a sheep herder. So I took care of a lot of lambs growing up and plenty of res dogs as well. And with this experience in early life, I initially focused on becoming a veterinarian once I was in high school. And also part of my early development is that I have been a runner most of my life, probably pretty much since this photo. I think I'm about 4 years old at this time. And a few other things is that I am a first generation college student, and an important note is also that my parents had me very young. My mom was 18. She had just graduated high school, and then I was born. So as any first generation college student, you know that it's a learning curve when you're the first to apply for college. So we all learned together about college applications and financial aid, all that good stuff. And I spent a lot of my early years with my maternal grandmother, and I am one of her first grandchildren to earn a graduate degree. And to put that into perspective, my mother is the youngest of 10 children, so I have plenty of cousins that are much older than I am. And my journey, I would like to say that ideally, my journey looks like this. I went to the University of New Mexico, graduated with my bachelor's in psychology, went on to the University of Wisconsin-Madison, got my master's degree, and here I am now at the Cancer Center. Ideally, I mean, that is what happened, but I am leaving out a lot if I keep it that way. My journey looks a little bit more like this. A lot of non-linear paths were taken. I eventually did switch from being pre-vet to psychology and shifting my focus to risk factor reduction and focused on more health promotion, healthy lifestyle interventions. Um, Following graduating from UNM, I worked on a study called the Child Health Initiative for Lifelong Eating and Exercise, which is now known as Chili Plus and still exists in the state of New Mexico, primarily in Head Start settings and early child care settings. With this, I would like to highlight that a lot of my journey goes back to the mentors, supervisors, and other research team members that I've maintained relationships with and who continue to support me throughout my journey. And also going back to this Chile study, I was able to use it as part of my master's thesis when the time came for that, partly because I was a part of the data collection and saw different trends as I was collecting data in different settings. So following grad school, I came back to Albuquerque and continued working at a federally qualified healthcare center called First Nations Community Health Source, where I led one more healthy lifestyle intervention research study, and decided maybe I needed a break from research. Ended up going to Optum and worked as a health promotion specialist. But research skills are everywhere. You still have to measure change. You need to know what works and what doesn't work for behavioral change. And so I didn't quite get away from research. And I ended up back over at First Nations because one of the relationships I had with a research team needed someone that was familiar with the clinic to start a study focused on mental health in a primary care setting. And so I said, I can do it. And, when you work with mental health and primary care clinicians in a clinic setting, when you're the only researcher, you're kind of the best researcher. So just a little plug in there. And eventually I ended up at University of New Mexico once again, and back at the Cancer Center when I realized my journey was kind of straying from the prevention realm. And so one more funny occurrence that had happened, which speaks to relationships and things coming back full circle once again, was I had someone send me this picture, which shows me that I apparently am the poster child for their student handbook at the UNM Prevention Research Center now. So be careful what the fine print says when you sign up for things, especially when you have your picture taken by your research group. So next I will go into the study where I have the study on the Zuni cancer study where I have been at the Cancer Center for the past 3 years now. And I would really like to acknowledge Mallory. Without this, without her artwork, we probably would still be wandering, trying to figure out how to convey cancer information. And alongside Mallory, I'd like to acknowledge our research team first and funders, and especially our participants, the men and women that in Zuni that participated in our study, which made it happen. And I'll go into just overall numbers of incidents, which are cases of new cancer cases and there's 3 cancers listed here. And if you look at the numbers, you can see that there's a discrepancy between our Native population and our non-Hispanic white population in the state of New Mexico. And following that, we also have mortality rates, which are the number of deaths. And you can see that there's a little bit of a difference there as well. But mostly if you look at for mortality, you can see there's a difference between breast and colorectal cancer. And I would like to also point out that these 3 cancers are screen detectable. And I will talk a little bit about screening. And the point of screening is to find cancer before symptoms appear. And when cancer is found early, we can treat it much more easily. And it also decreases the chances of dying from cancer. And the important takeaway goal from this slide is to show that our Native population aren't getting screened as well as we could be. So there's definitely room for improvement in getting our people screened. And screening recommendations are dependent on the cancer and frequency and age as well. I can go into that further or answer more questions about screening at the end as well. But for the sake of time, I won't dive too deeply into this. And I will also like to share that there are interventions that have been shown to work for each of these 3 cancers. So client-oriented intervention strategies are referring to things that work with people. So reminders could be phone calls, letters, postcards, small media, means brochures, posters, handouts. Education works, reducing structural barriers such as removing things that make it hard for people to access cancer screening. So it could be something like changing clinic hours so that people can get screened. Reducing out-of-pocket costs. So if the screening location is 100 miles away, people can be offered a gas card to help alleviate that. For providers, there's assessment and feedback, which refers to talking to a patient. If a patient needs screening, then the provider should recommend and facilitate that discussion to get screened. Patient reminders and recall refers to reminding patients that they have the screening appointment. And a recall system refers to those that have missed an appointment and try to get them rescheduled so that screening could be completed. Now, going back to the Zuni cancer study, our main goal was to assess the cancer control needs of the Pueblo and also to develop and pilot test an intervention for these 3 screen detectable cancers. And we had 3 aims, one of which had multiple phases, which I will also cover more in detail. And so I will describe our research setting next. And it's important to know that Zuni is one of the largest pueblos in New Mexico out of all of them. So you can see the various pueblos in the state. However, we are about 150 miles away from the UNM Cancer Center. And so we do have an IHS facility on the reservation itself as well, but if there's any cancer treatment needed, we're still 150 miles away. And it's important to know that the Pueblo has about 11,000 residents, with most people being able to speak the language at home. And most are, we've always been there, we call it home. Our language and culture are strong. And there are a lot of artists, and this is actually made by some local artists. And I will dive into these photos a little bit later too. And we received IRB approval from both UNM and Southwest Tribal IRB. Going to the study aims, aim 1, we created a tribal advisory panel, or TAP, in 2018. And this group of individuals assisted with recruitment, recommendations, and provided feedback to study design throughout the 5 years of the study. The second aim was to do listening sessions to gain perspectives on knowledge, attitudes, and beliefs about cancer. And this wasn't just with our TAP, this was also with community members and IHS providers. And altogether, there were 12 focus groups with a total of 114 participants. And here are some quotes that reflect the interventions that I had previously mentioned that help facilitate cancer screening. So you can see that there was some quotes about one-on-one education, group education, receiving reminders, small media, and also reducing barriers, primarily transportation to screening. Our phase 2 was a community survey, which happened in October of 2020 through April 2021. And this was during the height of COVID. So we definitely had to make some adaptations in how we did the survey. So not only did we have to pivot from in-person recruitment, we did random household flyer drop-offs. So our study team had to, run away from those res dogs that I had mentioned earlier. And so we unfortunately had to increase our timeline a bit because this added a little bit of time to do when you have to pivot. There was also a low response rate. Having to follow up on phone calls is a little bit harder rather than catching someone in person. And so a lot of our publications that we have so far are based on this community survey. And so these can be shared as well, this list of publications. From the community survey, we found that there were several preferred interventions from the community, primarily reminders, small media, and one-on-one education across the 3 groups that we had surveyed. So women 21 to 49 were focused on cervical, women 50 to 75 were focused on all 3 cancers, breast, cervical, and colorectal, and men were focused on colorectal in the surveys. I can explain more at the end if needed. And here's our timeline following the community survey. It's a little bit busy and a lot had happened in 3 years. But first I will talk about our design that happened over the course of 6 months to almost a year. We developed educational material based on the feedback in the survey where education and small media were preferred. So the brochure and fact sheet were created to be part of the education that people would receive. And we held listening sessions for 1 hour, wanted to gauge what the purpose, whether the purpose was conveyed, whether the materials conveyed enough information about cancer, whether it was clear, and whether the materials were comprehensible. And so I will share what before and after look like next. For colorectal, we used existing brochures that we had at the Albuquerque Area Indian Health Board. So this is on the left as the original, and this is the outside. It's a tri-fold brochure. And after our listening sessions, on the right side is the revised version. So this is very Zuni specific. It includes local photos of mountains around and also jewelry, and also our Zuni logo. Someone also had mentioned that we should match our overall colors to the Cancer Month. So this is blue in addition to UNM branding requirements. Here's the inside. So you can see that we have Mallory's artwork, photos from the museum, quote, testimonial or words of encouragement in Zuni as well. And our fact sheets were originally 11 by 17 with 4 pages. And this is the original of what it looked like for breast cancer. Here is the revised version.
And reason for visiting.
I was a little worried about the pink, but it turned out okay. We have a great marketing team at the Cancer Center that did a great job on all of this. And out of the fact sheets, there was a poster created as well. So it's the same information, just condensed into one 11 by 17 poster. For cervical cancer, we utilized women who represent public figures and strengths of Zuni. So for our educational flip charts, we have our Ola Maidens on the front cover. For the educational flip chart as well, we go through everything from risk and protective factors to signs and symptoms and some basic data at the end as well. And so I also have a cervical cancer brochure. And it's important to note that on this brochure, we didn't say cervical cancer awareness, we said cervical health. And the person featured on this is our Ms. Zuni, who is more of someone who represents all of Zuni women with her mother. And following the creation of all these items, our tribal advisory board wanted us to mail these to all mailboxes in Zuni. So we mailed all 3 brochures to 1,476 mailboxes in Zuni. One of our lessons learned, though, was that multiple households share one box. So maybe it would have been best to send these out more than once. So in order to hopefully reach more than one family. And so I will talk about the intervention next. We started our intervention in December of 2022 and continued into 2023. Our participants had to not be up to date on screening. For women, older women, 45 to 75, they could be not up to date on one and still be eligible, but they still got education for all 3 cancers. Participation included a survey once they were deemed eligible, education, and another survey 6 months after the first one. Participants received incentives for doing all 3, but not screening completion. And this is a little bit different. Other studies that I participate in have found that if you incentivize getting screening completion, then that does help your numbers, but however, sustainability of that practice comes into question. So that's another lesson learned. And because we were so in the throes of creating material, you can tell our recruitment flyer looks a little bit differently on the right side now. We are UNM brand approved, and because our timeline of this intervention overlapped with a summer, we had a student who wanted more research experience. So there's nothing like a community-based research experience than throwing a student out onto the res who is not from the res. And another lesson learned is, maintain some humor throughout this and also facilitate existing relationships. So on the right side is our 2 research coordinators with Fred Flintstone, who is actually, or is it Barney? I think it's Barney Flintstone, who is part of our community and outreach and engagement for the Cancer Center. So maintaining a presence was a huge thing and spreading awareness. Following our intervention, we did a few focus groups. We did 3 different focus groups where we asked the participants what they thought about cancer screening after having gone through the intervention, their experiences and decisions on their screening choices, and also study-specific feedback. And unfortunately, data analysis is still underway, and we have not presented our findings so far to get tribal approval. So I won't share those with the broader public yet, but those are coming down the pipeline. And next, I will go into our summer research program at the Cancer Center. The summer research program is titled Cancer Research Scholarship and Training Experience in Population Science. So the C-STEPS for short is part of the undergraduate pipeline network at UNM Health Sciences campus. We have 4 outcomes, or we have 4 items that we like students to participate in. Seminars and journal clubs on a weekly basis. We provide a mentored research experience, provide activity planning, skills development, and team building. So in the middle, you can see that there's pictures of students and what their individual contribution or quirk was for that summer. And then on the right side, you can see that this cohort at the end were so close knit, and they're wearing their t-shirts that they had created. And on the right side, one unique thing we also have about this program is that we bring in students from the prior year into the following year to be a peer mentor. So you can see on the right side, Sam here is a student, part of the cohort, and he is here being a peer mentor to last summer's group. Over the 10 weeks during the summer, the students also create and present a poster. Their poster is on their project that they work on with their mentor, and they also create a digital story at the end. And I use Jerry because he's our poster child for C-STEPS. And we also have facilitated and supported students attending the International Cancer Education Conference. So you can see here that a student from the 2021 cohort is presenting their summer research at the 2022 Cancer Education Conference. And Jerry here once again is presenting his summer research at the annual Biomedical Research Conference for Minoritized Scientists, or ABRCAMS for short. So we helped him with printing costs, shipped his poster there, and he presented, and we got this great picture of him. And here are where our scholars have come from, including 2024 in teal. And it's important to note that C-STEPS provides travel to students to get to the UNM campus and return back home, which the larger program sometimes does not provide. So we try and help our students as much as possible in terms of that. And our application opens October 2024. I'm not sure if any of you are familiar with C-NACHE, but the application opens so that by the time C-NACHE happens, people can start applying around that time. And I would also just like to mention that we have 2 post-bac research experiences at UNM as well, one of which is at the Cancer Center. So it's a 1-year post-bac program where you are hired as an employee to gain more research experience as well. Additional opportunities. And I have included the QR code for the C-STEPS website, and we also have more information about the program on there in addition to the application. And I've also included my email on the slide and also the program email as well. And Alakwa, thank you. And I will hand it back to you, Carmelita.
Okay. Thank you so much, Judith. I do want to go ahead and share my screen again, but you'll soon see here that we're going to move into our official question and answer session, our Q&A session with Judith. Again, Judith, thank you for sharing more about the Zuni Health Initiative and the important implications that it had for increasing community tailored cancer education for your people. I also really enjoyed the references to the res dog, because I know that a lot of us here who have done that community work, that is like a very real part of that of research work if you're in the community doing that. So thank you for sharing the realness about that. Now that we are in the Q&A session with Judith, as you'll see on the screen there, we would first like to welcome questions or any feedback, thoughts, comments from our student participants here in the room. And then after that, we'll then open up to our broader audience here. But I want to say we have time for about, I want to say 15 minutes of question and answer. So there's a variety of ways that you could do that. You could either unmute, raise your hand, let us know if you have a question, if you want to talk, or you could just directly put that into the chat, however, whichever way is most comfortable for you. But this is a chance to just share with Judith, engage with her. So the floor is all yours. Okay, I'm just looking through the room. So if you're currently thinking about what kind of question you're going to ask Judith, I would say feel free. If there's anything else you want to share, go ahead and go for it. But I do see a hand raised. Rachel?
Can you hear me? Can you hear me okay?
Oh, yes, yes.
Oh, okay. I was just curious. Well, comment first. Really good job on your presentation. This is really awesome. My question is, I'm just wondering if you plan to do additional studies or research or surveys on any of the other screenings or types of cancer that are able to be screened for? And if so, what are they?
Not at this time. We still have yet to provide our findings back to the tribe. And based on that, we will see what direction they prefer and also with guidance from our TAP. So still need to be determined.
And I guess the second follow-up question is for the types of cancers that you like gave your community information on screening information for, did you guys go in deeper depth about what screening entails?
Yes, that was a part of the educational flip chart for each cancer. So we went over the various ways to get breast cancer screening, what cervical cancer screening looks like dependent on your age, and also what the many forms of colorectal cancer screening. And we primarily push for colorectal cancer screening to be FIT because we know that the IHS in the community has that available. They don't have colonoscopies available. So, you know, a screening is better than no screening was our motto. If we could just get one person to get screened, that was the goal. Yes.
That's awesome. Thank you.
Thank you.
Judith, I think you also mentioned that you had other colleagues here in the room. I also want to just welcome you all if you're here in support of Judith and you also worked along with her on this project. Feel welcome to share any additional thoughts or comments about what was shared or what you learned throughout that initiative. Okay, Nina.
Hi, good morning, Judith. My name is Nina Trujillo. I'm a student with the University of Arizona grad program. I had a question. I might have missed it, but was there a certain age group that you guys had focused on? Some research that I had done before was there was quite a big increase in colorectal cancer among young people. And have you gotten any data related to that among Indigenous people?
Yeah, thank you for that question. And specific to colorectal cancer screening, from the community survey till the time we did the interventions, the recommendation for age did change. It actually went down from 50 to 45. So for our intervention, we included those men and women for colorectal cancer screening, ages 45 through 75. All these cancer screenings are dependent on age. So our youngest that we recruited were 21-year-old women for cervical cancer screening, up to 75 or 74 for breast cancer. So we had a varying age range. And so we tried our best to include the 45 to 49 age range for colorectal cancer screening, but that group is a hard group to reach, is what we've learned. And then going on to your question about Indigenous data, unfortunately, as a research study team, we can only provide data using New Mexico data. It has to be the tribe that requests specifically from IHS to provide their numbers. So that was one learning curve that we all had. And so tumor registry data does include Indigenous peoples and also SEER data as well. And there's plenty of great efforts here in the state of New Mexico trying to align and ensure that our Native peoples are being identified appropriately as well. So hopefully it makes it easier to pull that information from the tumor registry as well. Did that answer your question?
Yes, definitely. Thank you so much. I really appreciate it, and I enjoyed your presentation today. Thanks again.
Thanks.
Any other questions? So Judith again talked about her academic journey, her professional journey. We learned about the Zuni Health Initiative, the ways that the findings were able to help them tailor the cancer education materials. And then we also talked a bit about the C-STEPS program. So if any of that helps you to formulate a question or maybe some thoughts, that's something I offer. But as we're waiting for any additional thoughts or comments, I do have a question. So in the work that I do, I've always been more of an artistic person. So I get really enthusiastic when it comes to designing just the visuals of handouts, the flyers, brochures that are going to go out, or even the presence like online social media. And so that's like a part of my personhood that I contribute to the team. I'm wondering who did that for your team. Was it somebody that you hired out, or was it somebody internal to the team who also had, I guess, that enthusiasm for arts and like really helping to create eye-catching graphics or eye-catching ways of communicating that important information?
It was a combination of all of the above. Our research coordinator in Zuni, Samantha, she took on the role of trying to pull things together, knowing that you can only use certain images from the websites, such as ACS and NCI, for educational purposes. And then we also have a great marketing team that kept us in line with the branding requirements, the colors, font. And I believe it was actually Samantha as well that had made the initial outreach to Mallory. I see her name on here, but I don't also want to put her on the spotlight. But I will put in a plug that her area is translating science using artwork. So the border that was on my PowerPoint is her artwork. A lot of the images that were used, it was our TAP that went to the museum to look and scan them. And the jewelry photos were brought to us by the TAP, and we just took pictures. So it was really a group effort, and a combination of the team, outside the team, and higher ups in marketing. So it was overall team effort.
Thank you for illuminating that. I think my follow-up question really is around, have you noticed a difference or a change in the way that people are being receptive to the new adaptations, the revisions that you have made? I think what I had in mind was the way that you changed up the language. Instead of putting on the header cancer, or I think it was cervical cancer awareness, you put cervical health like this. In your observation, has that made a difference, a good difference?
Yeah, people were very excited that there were handouts made specifically for Zuni when they receive brochures and at events, community outreach events that our team was a part of, they were realizing, oh, that's in Zuni. I know where that is. I know where that picture was taken, and so overall, I think it created less of a barrier to talk about cancer with our research team. And it also helped with recruitment as well, knowing that there were material out there that were made for people who live there. And, it was very, very specific for Zuni. And I think that created some excitement there.
Thank you. Okay, we have about 4 more minutes. So if you have that burning question almost like fully formulated, now's your time. I do also want to mention that Judith is gracious with her time, so she will be staying a few minutes after the presentation has concluded. If by that time you just want to have more of that direct one-on-one, we'll have that time, and I just want to make you aware of that. So with that, if there's no other questions that I'm seeing or any hands being raised, Judith, I think I would put you back on the speaker seat and maybe just share any final thoughts or final reflections that you've had with your experience with this research project, or even just your overall journey in general.
Yeah, I think when I was making this presentation and putting it together for students, it reminded me of when I was applying to grad school, and just the relationships that you build over time. And you're always going to have supporters that support you all the way, 100% all the time, right? But then you're also going to have some that kind of don't and are unexpected. And in my experience, I will share that when I was applying to grad school, that I had reached out to another fellow Zuni who had a PhD, and she was also in clinical psychology. So I figured, hey, reach out, see what their experience is like, if they plan to come back to Zuni in some way, shape, or form, either physically or to do research. I reached out to her with that question, and the response that I got wasn't very positive. And so I think knowing that it was more like kind of fate that me being a part of this research happened, because the PI, Dr. Shiraz Mishra, is of the cancer study, is also someone that I had met when I did this 2-year internship when I graduated from UNM. So the world of cancer research, the world of Native research is very, very small. You may mention a name and someone else at a national conference will also know that person too. So just like to put it out there that, find your people, make sure you keep your people updated, and you do you.
Thank you so much. I think that's a really good note to end on, and so important. I think just in our journey in general, but I think also in alignment with a lot of our principles that really emphasize relationships and kinship. So yeah, it never ends. So you can continue building on that as students, and then going into being a professional and just a general everyday community member. Relationships and kinship are very important. So with that, I'll go ahead and close this up here. Thank you so much, everyone. Judith, for being our presenter, for sharing your knowledge, your experiences with us, and for our students and our audience members for sharing your valuable time with us this afternoon or this morning. I would like to invite you all, before you jump off, to either you could put that URL into your browser, or you can scan that QR code with your phone or any other mobile device with camera functions that you have, and that will take you to our evaluation survey. It's very brief. Let us know how we did, and your feedback is very important because it helps us to enhance our webinar series going forward for the Center for Native American Cancer Health Equity's quarterly webinar series. Thank you again so much for being here, and we hope that we'll be able to see you again at the next webinar. But again, thank you and enjoy the rest of your day. And for those of you who want to have that one-on-one time with Judith, she will be here for at least another 5 to 10 minutes. So if you want to have that one-on-one, now's your time. But thank you again so much.